Welcome back, Dr. Ibe, once again, your platform medical advisor. I can't help but to talk about a couple of queries one of my very, very good friends have regarding prostate cancer and stroke. Both of his parents had strokes, and indeed his dad died of prostate cancer after having a stroke. And I'm so sorry to hear this. I promise that we are going to talk about these two conditions separately because they are very vast. Now, let's start with the prostate cancer. We had talked about this in the past. The prostate is that organ that sits behind the bladder, around the bladder, that helps for the formation of sperm, semen in men. And this prostate cancer is much more common in black men than in white men. And what I do usually in my practice is I screen every black patient from 45 years onwards. I send them for annual PSA, annual prostate specific antigen. Okay, and depending on the findings of this PSA, that can be done regularly, maybe every 6 months, or if it's too high, you can be sent for further investigations, like MRI scan of the prostate, biopsies, and so forth and so on. Reason being that if you screen early, if you do this PSAs regularly, you can then catch the prostate cancer on time. And I do this regardless of the symptoms someone presents with. Obviously, the symptoms of possible prostate cancer or enlargement is passing urine more at night, maybe 2 or 3 times at night, dribbling of urine. After you pass urine, you still dribble, and urgency when you're full, you have to go. If you have to go, you have to go. You can't hold your urine for a long time. Erectile dysfunction, it can affect your erection. In fact, most patients have been diagnosed with prostate cancer just for the fact that they can't hold their erections. They had erectile dysfunction. When you screen them, do the PSA with other tests such as testosterone, you can see that they are abnormal, and you can then diagnose the prostate cancer. So it's important to get checked. It's important to get screened. I can't emphasize on this enough. All Afro-Caribbeans, all black patients on this platform over 45, you need to know what your PSA is. I know what mine is, and I won't tell you. Anyway, okay? There are some risk factors to this prostate cancer. The age, the older you are, the harder your prostate is, the more prone it is to becoming cancerous or enlarged. There is the family history. We mentioned that if your uncle or your dad has or had prostate cancer, that makes you much more vulnerable to having prostate cancer. Lifestyle, therefore, obesity is a risk factor. Obese patients are much more likely to have prostate cancer. The bottom line is screening, and making sure that any symptoms you present with are not trivialized. Any symptoms with your urine, they are not trivialized. Okay? When you get that screened, if it is high, you are referred, you undergo further investigations, and if it is cancerous, that can be managed. There are some complications to this prostate cancer, unfortunately. It can spread to the nearby organs like the bladder, the bones, the lymph nodes, and other organs as well. We mentioned about libido. It can affect your libido, your erections as well. It can make people incontinent. You can't pass urine anymore. You can't hold your urine. Some of them are placed on catheter because they can't pass urine. They can make incontinent, which is the more reason why the earlier you diagnose this prostate cancer, The earlier you get checked, you check your PSA regularly, the earlier you do that, the better for you, the better for all of us. Okay, the prostate cancer is very common, it's on the increase, it's on the rise all over the world. You can't say the Western world or non-Western world. It is all over the places. It's in the increase. So once again, screening. Make sure you check your PSA. Any issues with your urine, passing more at night, dribbling, can't hold your urine, being incontinent, having erectile dysfunction, issues with your erections, please contact your healthcare provider. Be safe and play safe. God bless. Bye.